Good afternoon and welcome to Bariatric Friday. My name is Kemal, Erkan. I'm the chairman of American Surgery Center. I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Again, very happy to be back at another session of Bariatric Friday.
Well, thank you for joining us. So we are going to actually discuss something a little bit interesting, and perhaps some people, they don't maybe even understand why we are even talking about the intermittent fasting or intermittent diet. So we already know that bariatric surgery is a very powerful tool for morbid obesity. So, but while we are going through this pre and post-op, we have ways of preparing our patients either for the surgery or for the time after surgery. And intermittent diet, intermittent fasting is something that Dr. Irgau introduced to our bariatric program. Initially, I also didn't understand, and we did several sessions prior to this. And every time we do another session, I see some of my people here or some of the friends, they said, well, they started the intermittent fasting. So this is another tool that can be utilized for our patients, right? So we want to better understand how we utilize this, and Dr. Irgau, that's where we need your help. So
Absolutely.
if you can explain how it should be used, when it should be used, what precautions we should be taking. Are there any practical tips that we can actually make this easier and make better decisions?
Absolutely, absolutely. So very good points, of course, Kemal. As you said, we specialize in bariatric surgery, weight loss surgery, which currently is by far the most effective treatment we have for morbid obesity, and that is obesity that has become extreme, where a person's weight may be as much as 100 pounds over their ideal body weight or more. Having said that, as you correctly said, bariatric surgery is a very, very powerful tool. It doesn't mean necessarily that a person who's had bariatric surgery and they're succeeding with weight loss should not be careful about their eating habits or the level of their physical activity. We always talk about bariatric surgery being a tool, essentially, right? And then as we prepare patients for bariatric surgery, as you said, and we introduce them to healthy lifestyle concepts, one of the things we talk about also is intermittent fasting. So what is the concept with intermittent fasting? Essentially, the concept is you have to define in your waking hours the times in which you will allow yourself to eat. In other words, you shouldn't be open to eating all the time in your waking hours, right? And that is makes sense if you think about it, and most people really see immediately the usefulness of this, because one of the problems we have in our society is we have a complete and total availability and accessibility of food, right? Wherever you go, whoever your company is, whatever you're doing, there is food around it, right? Now, when you look at it from the point of our ancestors, whose really main threat to their existence was really hunger, right? Finding food was an extremely essential task every day. And they were not successful all the time, which meant that they went without eating for very long periods of time. So establishing a society where food not only is not a problem, but it is a luxury that is found everywhere sounds like a heaven, a great idea. But as we have found out, obviously, excessive eating associated with decreased physical activity has resulted in this terrible epidemic of obesity. And of course, obesity is associated with so many illnesses that really impinge into our quality of life, but also threaten the length of our lives themselves. So in a society like this, saying to yourself, okay, I will be eating only from such time to such time. And then on the other periods, I will be fasting. I will not be eating. That conscious effort actually makes a lot of sense, because that will immediately result, without any question, in a decrease of the calorie intake, right? If I don't have this schedule, Kemal, and I wake up in the morning, I may go to the kitchen, I may have some coffee, I may have some breakfast with it, and then I might drive, go to work, right? And at work, I will have snacks and other things lying around my desk. If I go visit my colleague in their office, they will have snacks on their desk. If we huddle around the coffee pot or the water pot, whatever we call it, and we talk, there may be snacks there. If we decide to take lunch together, we may be talking about the food that we're going to have. So a lot of feeding occurs almost constantly. We've turned ourselves into a species that is almost grazing, to take the word from the animal kingdom, right? Where you see, sheep and cows grazing all day long. They are in the middle of their food, grass, right? So all they do is all day long. So we turned ourselves into that situation. And what is that doing to our body? What is that doing to our metabolism? Well, first of all, there is no limit to how much calories we're ingesting, right? And our body, the more calorie we give it, the more it stores it, because our body is programmed to really help us in times of fasting. So what it does, it stores, and the way it stores is in the form of fat, right? And in addition, by doing that, we are developing all these diseases associated with obesity. So introducing a concept which says, you know what, I'm going to get up, I'm going to have my coffee, but then from this time until X time, and it doesn't matter what that time is, I will abstain from taking any calories proactively. So that immediately is creating a window where you really are not allowing yourself to have any food, right? And then to that, you're adding the time of fasting associated with your sleep, because when you sleep, as we all know, you don't eat. So if you take a 24-hour cycle, which our day is a 24-hour cycle, and if you assume, for instance, we sleep for, let's say, 8 hours, okay? If you're adding 4 more hours of purposeful fasting, now immediately within the 24 hours, you will have fasted for 12 hours. Well, let's say you add a 6-hour window in which you are fasting. Well, now immediately you're having 14 hours out of the 24 in which you're fasting, and so on and so forth. So the concept makes sense, and it's perfectly suited to our environment. Now, how do you practice it? Well, you can divide that 24 hours in whichever way you want. You could talk about, 16 and 8, which means 16 hours you're fasting, and then 8 hours will be your eating window. Or you can do, 18 and 6, or even more, involved than that, where you go to 20 hours of fasting and only, 4 hours for your eating window, which means basically eating only once a day. Throughout the period of fasting, what is very important, however, at Kemal, is you have to continue drinking water, because we are fasting from, refraining from intaking food, but water we need. Water is something that our body needs. So the longer you're fasting, the more water you will need, basically, because when you're not eating, you're also missing the water portion of the food that you would have been eating. So you have to proactively.
So we have to drink more water.
Absolutely. And then the other reason why drinking water is important, Kemal, is very often when we feel hungry, we're actually thirsty, but we mistake thirst for hunger. We just don't understand. We've lost sight of what it feels to be thirsty or hungry, unless you go into extremes of each one. And then suddenly you eat, that feeling goes away. Well, maybe you were thirsty, and when you ate, you introduced water with the food so that the thirst went away. So you think hunger is the problem, but when really thirst is the issue. So how is it different from any other, dietary approach? Well, this doesn't cost anything, right? You don't have to buy anything. You just have to refrain yourself. And from a financial point of view, actually, you could even save money. So that is the concept. And there are different schedules. As I said, you can talk about, whether your eating window is going to be in the morning, whether it's going to be in the afternoon, or whether it's going to be later in the afternoon, depending on your schedule, depending on your comfort level, and depending on what kind of person you are. Some of us are breakfast eaters, for instance. We cannot get our day started unless we have a good breakfast. And some people are just don't care about breakfast, and sometimes they even force themselves to eat breakfast just based on this idea that breakfast is supposed to be the most important meal of the day, right? So depending on where you are as a person, you can schedule yourself to different ways of determining when your eating window is going to be and when your fasting period is going to be.
So I think when we discuss these topics, and as many people now, by now, they know that we deal with a lot of patients, we go through a lot of patients, and not just from the bariatric side, but from the primary care side as well. So then we have 2 sets of case conferences, and it gives us different information on many things. So I just want to tell you one new thing that I read in one of the doctor's notes. Patient BMI is about 42 or maybe 47, I may be wrong, like 42 or 47, it's both high. And patient didn't want to do bariatric surgery, wanted to try the new weight loss drug. Again, this medication it's a tool, right? So the tool, in a way that I see when we every time we use the tool, then they come with different size. So based on the problem that you have, if you have to take this huge wall, you cannot do that with a small hammer, right? You have to have proper tools in place. So based on, I just want to kind of maybe address this misunderstanding of when we take medication, or when we do intermittent fasting, or when we do bariatric surgery. All those are different size of tools for morbid obesity. But this patient's expectation was, I'll take the medication and I'll be fine in 2 months. And I'm reading the note that the patient didn't follow any of the diet instructions or any of the fitness instructions. So we all want to believe in this magic, like magic to make me younger, or make me lose 25 pounds, or make me taller. Like there's a guy on TikTok, apparently I just saw it on Twitter. He went through this surgery that makes him taller, and now he lost his health. We want these things. We want these magical, right away, overnight solutions. That's not there. So when we discuss what I was going to ask you with this, if I'm BMI 57, intermittent diet or intermittent fasting by itself is not a solution. It can be just it's ancillary to the main tool, the bigger tool, right? So can we just elaborate that a little bit, so that this is not, we are not saying that you can do this at any level and you'll be able to get the same results. That's not the case.
Absolutely, absolutely. I mean, the key issue here, again, and you and I have talked about this, Kemal, before, is to understand what obesity is. Once you understand that obesity is a disease and you have to treat it as such, then there is no issue about, I'm going to start gently and then I'm going to work my way up to see if this works without doing this and without doing that. If you identify that a person has a cancer, Kemal, you go to the most effective treatment immediately. Or if somebody presents with a newly diagnosed type 2 diabetes and you do their blood test and you have an AC1 of 12, right, Kemal? You don't say, okay, well, let's start with diet and lifestyle modification and see what happens to that AC1.
Exactly.
Right? What you want to do is you want to implement the most effective treatment soon. That is going to be appropriate for that particular situation and for that particular patient, right? So still, our concept, even in the most understanding situations, people look at obesity as a appearance problem primarily, right? When a person is morbidly obese, Kemal, they cannot hide their disease. Their appearance, your first view of them, tells you what disease they have, right? That's not the case with somebody who has diabetes or who has high blood pressure. You don't know if you don't know. But if a person presents to you with morbid obesity, their appearance is the evidence of morbid obesity. And we look at it and we have all sorts of ideas going out in our mind that are really ingrained based on years of bias and stigma that is attached to obesity. right? So instead of looking at healthcare workers, instead of looking at it as a disease, just like diabetes and others, we look at it in this biased fashion. So our approach is also biased in that sense. Now, the most important factor here to understand is when you see the severity of obesity disease, you have to provide the most effective treatment. But that should not necessarily be the only thing that you're going to provide them. You can bring along that many other things that are definitely going to help, right? So when you have somebody presenting with a body mass index of 50 because they are 125 pounds over their ideal body weight, or, or more, you're going to say bariatric surgery is the most effective treatment for Irgau. But with that, it doesn't mean you're not going to talk to them about lifestyle changes. It doesn't mean you're not going to talk to them about the dangers of snacking on highly processed food all day long. It doesn't mean you're not going to talk to them about the importance of eating early before they go to bed as opposed to late. It doesn't mean you're not going to talk to them about the need for physical activity. You will, but you also know in your heart that just doing lifestyle changes and physical activity is not going to get that person with a body mass index of 55 anywhere. And you need them to stay healthy, to be healthy very soon, right? And then the other issue, conversely, the need for instant, you can't hear well?
For 10 seconds, I lost you.
Can you hear me now? All right.
Yeah.
Okay. So what I was saying, the other issue that you brought about is this cultural issue we have about the need for immediate result, instant gratification about anything that we have. It has to be here, it has to be now, right? And I need to see the results. Well, when you treat morbid obesity, first of all, you have to set the expectations right. You're not dealing with an acute illness, you're dealing with a chronic illness, right? You're not dealing with something that happened overnight, you're dealing with something that took years to develop, right? So in essence, even your solutions have to be tempered within that. Mm-hmm. Whether you're offering medication or whether you're offering bariatric surgery, your approach should be the same. Now, is there a place for medication? Yes, particularly the new medications that are coming out now are very exciting. We don't know, obviously, the whole story yet because we haven't tested them in the real world for long enough time, but they are definitely different from the previous medications we had, and the excitement is truly justified, right? But that should not be the only tool, and your analogy of trying to take down the wall with a little hammer makes sense, right? You have to use the appropriate tool for the appropriate circumstances, essentially. Within all that, so where does intermittent fasting fit, Kemal? It fits pretty much like the other options, right? It shouldn't be the only option, and it may not be the best option for everyone, because again, we're all very different, right? Just like when you're treating somebody for high blood pressure, Kemal, you don't come up only with one medication. You may find that this medication works well for patient A, but it doesn't budge when you're dealing with patient B. Maybe patient B will need a different medication that tackles high blood pressure from a different view. And this is the same for morbid obesity as well. And that is sometimes you can see even with the type of procedures, Kemal, you can see certain patients responding very well to one type of procedure and not so well for another, right? So we have to use our tools with the best knowledge we have, but at the center of it all, we have to place our firm understanding that we're dealing with a disease and not with a personality or quality or appearance issue when we're talking about morbid obesity.
So let's go back to the intermittent diet a little bit. So then I'll ask you some practical questions. Now, you and I, we do this sometime together we do it, sometimes we do it independently. My challenge usually is, let's say if, one thing that I think you said earlier, so let's take care of this time issue, right? So 14, 15 hours. So if you stop eating around 9 p.m. at night, and then 12 hours is 9 a.m.
Yes.
And then 3 more hours is lunchtime. That gives you 15 hours. Yes. That's very easy to do for anyone, right? So because if you eat after 9, is it binge eating? Kind of like that's one of the things that people are struggling with, and some of our bariatric patients as well. So if you get up 2 in the morning and go to the fridge, and then even you take, like maybe you think that it's unhealthy fruit or something, that still just destroys the flow, right? So then it stops everything that you started 6 hours ago.
Absolutely.
So one, that time to time I do it too. So I'm not going to pretend like, and we are not pretending here. So then we go through these issues all together. We struggle together at different levels.
Yes.
So I want to stay on my size 54 max. If I go one size up, it's a huge problem for me because I have to go through so many new suits and new everything. So maintaining is challenge because it comes with age. So, and it's not just with the diet, right? So, but my problem usually is when I get up in the morning. So if I have an apple, for example, which I do, and I interrupt that whole flow, right?
You have. So the idea essentially is comes from the understanding, Kemal, that when we are fasting, right, our body actually does what is called a metabolic switch, okay? In normal situations, the most important source of energy for most tissues of our body, Kemal, is glucose. It's sugar, right? But when we go into a situation where we don't provide our body with sugar, let's say for 12 hours or more, our body switches to something called ketones. And the ketones are substances that our body gets by breaking down fat, right? And the time in which this happens most is actually in the middle of the night, right? If you look at an enzyme called lipase, which breaks down fat cells, it's actually most active around midnight for most people, which means it is at a time in which you have not had much to eat for quite some time, right? So it starts breaking the fat to provide your brain, especially, which is very, very particular about the type of substances it needs. It can use either glucose or ketones only. Our brain, that's all it can use, right? So if there is no sugar, we have to provide it with ketones. But what we have found out is, Kemal, is when you are switching to ketones, there is actually a lot of benefits that come with it, right? Glucose regulation in our blood becomes better. Well, when we regulate glucose better, it means we decrease the risk of diabetes, or if we had diabetes, it becomes better. The stress response somehow is better. Inflammation is improved, and even things like aging could be even slowed down when you do that. So the idea of people who really promote fasting as a way of doing that, Kemal, is because of all these benefits. And, we do have a lot of knowledge from the past, from institutions, for instance, religious institutions, where people practice fasting for religious purposes. And yet there are many, many benefits that we see in those people from a health point of view as well. So I think there is a lot to be said about abstinence from food as much as you can. Now, to go back to the issue that you mentioned, if a person, for instance, prefers to eat early in the morning, then what I would counsel them to do, Kemal, is to start their fasting maybe in early afternoon, right? So that they can eat in the morning. So they will eat in the morning and they finish their eating window by mid-afternoon, let's say at 3 o'clock or 4 o'clock. And from then on, they just have water, they go to bed. And then when they wake up the next day, even early, they can have something to eat until they start again, right? So there are many ways of using that. The key, in my view, Kemal, is to really have a process within your schedule where you say to yourself, as far as eating is concerned, I'm not open to business all the time. I'm open only sometime, right? Just like businesses, like, come on, they're not open 24 hours except for a certain type of businesses, right? Most businesses will have hours in which they're open and then other times they're closed. And the other issue you and I talk about is the fact that the digestive system is not a system that is kind of turned on just a little bit for a little bit of food and more for more food. It's either turned on or it's turned off, essentially. So when we turn it on, we turn on a machinery that is so energy consuming, that is so involved, that for us to have this going on, all the time when we are awake, it must be exhausting to our body. It must be the cause why very often we age so quickly. So fasting could be useful from that point of view, if you think about it.
The intermittent fasting actually originated from the studies on aging.
Yes, absolutely. Absolutely.
The benefit of one of the benefits that they didn't expect, but aging actually, where we actually look at how our body works, and every time we do X, Y, Z, that's the whole machine is working. Understanding that, it takes time. Look, I mean, some days I'm doing intermittent fasting, but I'm like, well, I had an apple this morning, or I had something else. Even though it's small, then sometimes we don't think as like that's going to do the same. It's going to trigger the same things that the big meal would. So, but again, this is a tool. Now, you mentioned something earlier about overall health, and I'm reading one of our support group messages. This is 6 hours ago. Mm-hmm. Everyday life is different for me now, and I'm more than thankful. On top of looking and feeling great, I have been discharged from my cardiologist, who have seen me since I was 14, mm-hmm. and my endocrinologist had greatly lowered my dose of one of the medications. Mm-hmm. While losing weight is great, I'm far more impressed and pleased with the incline of my health. So this is one of our patients. Yeah. Now, I'm again reading this directly from our support group. Mm-hmm. And if you are our patients, or if you are about to get the surgery through us, this is a private group. You can always join if you're part of the program. Another patient 3 days ago says, 3 years apart, the sleep truly was a tool that's needed, lost 54 pounds. Now, these are not paid promotions, so these are actual factual comments from our patient. Another patient, 2 years anniversary, 150 pounds. So imagine like losing 150 pounds. Yep. And what this person, and in the support group, like one person is looking for a walking buddy. So because when you do things in a pair, things are a little bit easier and you get better support. So this is an extremely important tool to fight morbid obesity, and we believe that intermittent fasting can enhance the process, can be a tool for time to time that person can utilize. And also it's going to help with the aging and better understand your body and what they're going through. And we have done several sessions regarding this topic, and then we went into, we try to cover it in different ways. So if you are really interested in finding out more, you can always watch those as well. And hopefully we are able to provide more information for you and more useful information. And that's our goal, so that we can be part of your journey to be healthier and have a longer life. And Dr. Irgau, thank you for joining me again.
No problem, Kemal. I just want to add something very quickly, Kemal. It's, when we talk about intermittent fasting, obviously for the vast majority of people, it's fine and they can work with it. But there are certain, situations where people might be better off consulting with their doctor before they do it. For instance, people who have diabetes, people who have congestive heart failure, obviously very young people, or people in the other extreme of age, pregnant women. This would be situations in which before you fast, particularly for a prolonged period of time, you have to consult your own doctor.
We are supervising that. It's
Absolutely.
surgeons. So that's a really important point. So if for healthier or patient with no morbid obesity or no chronic illness, if you use this, that's one thing. But we are actually specifically talking about how this is utilized in the bariatric program, so that there is a better understanding of the process. Well, again, thank you so much, Dr. Irgau. We'll be back next week. Have a great weekend. Bye-bye.
Thank you. Bye, everybody.